Now, I want to do something a little different than we've done in prior years, and I want to show you how things have changed. You know, the clinic began, some of you know, in 1989. The clinic's been around for 22 years, but in the beginning it started just as an eye clinic, strictly for eye care. And so from 1989 to about 2003, all we did was eye care. And in 2003, we added dentistry, general medicine, and a regular operating program. We had operated before that, but incorporating a regular surgical program. And so since 2003, over the past 8 to 10 years, we've really changed quite a lot. And sometimes you don't notice things when they seem to happen slowly, but we've changed quite a bit. This is the area behind our patient quarters. This is off to one side of the property. And certainly we concentrate on clinical healthcare activities, but over the years we've developed some other programs as well, probably the most important of which is our Kids Club. And I think I put in one slide of our Kids Club. Our Kids Club meets once every 2 weeks. It's run by 2 of our employees in San Lorenzo. We have anywhere between 250 and 300 kids that are involved in our Kids Club. They don't all come all at once normally. And it got to be so big that it was actually pretty disruptive to have it going on the patio while we're trying to see patients. And so we needed somewhere, kind of a multi-purpose area where we could have other types of activities, Kids Club, Women's Club when we're able to have it, church activities. And so out of that desire came what we call our ministry area. And this is our ministry area. And again, we have our Kids Club there, our Women's Club. The church, the local church with whom we are affiliated, doesn't have a building right now. They're in the middle of a building project. And so right now, all of their church meetings happen here, prayer meetings, retreats. They have retreats for men, for women, for youth, any other church activity. And so it's really been a big blessing to have this building on the property. Then when the initial clinic building was built in '89, there was criticism that it was much too big. We'd never use all that space. And that was actually before my time, but as we began to add services and do a little more complex surgery, it actually became much too small for what we needed. And so we needed more clinical space as well. And this just empty area back here is behind the initial clinic building on our property. And so we wanted more clinical space, and this is what we still call the new building, even though we've been using it for 3 years now. Most of the second floor is outpatient area, exam rooms. We're not using them all now, but we built them because I know that sometime here in the future, people are going to be dying to come to San Lorenzo to help us out. So we've got space for them when they're ready to come. And most of the first floor has to do with our surgical services. We have there our operating room, our recovery room, sterilization, laundry, storage, and kind of a break area for our employees. And then this is 2007. This is what the front of the clinic looked like back then. And we'd always kind of hoped to do something to make it look better. And we had a group, that first group that Mark Wurzel talked about, the first group that he came down with, they helped us kind of give this area a facelift. And so they laid pavers for us in the front of the clinic. And so this is what it looks like now. So they really, really gave the front of the place a facelift. Now, obviously, I'm going to tell you about how our surgical areas have changed. And when we only did eye surgery, and as Mark said, most of it was cataract surgery and pterygium removal. This was big enough, but as we began to do more and more, this got to be a bit of an inadequate space. And this is what our OR, our operating room, looked like in 2004. And in that big yellow building, I mentioned we have a new operating room, and this is what it looks like. And this slide's actually from 2003. Back in 2003, there wasn't a whole lot that we could do. Most of our stuff we just did with gloves. Most of it was under local anesthesia. And this was a typical procedure in 2003. Patient awake, local anesthesia, not terribly complicated. This is a little more of a typical procedure now in our new operating room. And then I put this in. This was our operating room running at capacity back in 2003. We had portable oxygen tanks. We did, for those of you who know anything about medicine, we had a pulse oximeter and a Dynamap. We didn't have any continuous heart monitor. We did occasionally, this is one of my favorite anesthesiologists, we did occasionally have anesthesia, but all of it was either local or regional anesthesia. We had no anesthesia machine, no electrocautery. So this was about the most we could do. And now this is our current operating room running at capacity. We've got, can't see it very well, we've got central oxygen, an anesthesia machine, heart monitor, electrocautery, and we can really give fairly complex surgical care now. So I made some slides. Can't forget. I just wanted to show you what we actually do now compared to 8 years ago. And this was the extent of our procedures in 2003. Removal of small soft tissue lesions, cysts, little skin lesions, umbilical hernias, inguinal hernias, and tubal ligations. And that was about everything that we did. Now, in 2011, we can do those same things, umbilical hernias, inguinal hernias, tubal ligations. We do ventral and incisional hernias. We take out a lot of ovarian tumors. We do a lot of hysterectomies, drainage of intra-abdominal abscesses, appendectomies. We do small bowel resections, large bowel resections, ostomy reversals. We do gastrectomies, both partial and subtotal, amputations. We do open gallbladder surgery, and we do now do laparoscopic gallbladder surgery. We do bile duct explorations. We do mastectomies, thyroidectomies, parotidectomies, prostatectomies. We do trauma when we're able. We do a fair amount of pediatric surgery. Most of that is hernias, but other things like thyroid duct cysts, branchial cleft cysts. And so the scope of what we do has doubled or tripled, really. And so I just made these comparison slides to show you where we were and where we are now. This is our operating room in 2004 and today. Typical procedures 8 years ago and today. I like this slide. And then that's the comparison of what we do now. That's not everything we do, but that encompasses most of what we do compared to 8 years ago.